Hi everyone. Sorry you can't see me during this. I want to make sure that you have full view of where we're going to be demonstrating all of your basic Swedish massage techniques. Okay, another video where we will be going through actual positioning of pillows and draping and positioning of your client. But today we're just going to jump straight into showing you the techniques and how to perform them on the back of your client. Okay. So the first one I'm actually going to begin with is muscle compressions. Okay, these actually fall underneath groupings of techniques that we call petrissage. Okay, I like to start the beginning of my treatments with muscle compressions. So what you're doing is you're basically going to be pushing down and squeezing on the muscles at the same time. I like to do this right over top of the sheet before I undrape them. What this does is it introduces the client to your touch, and it also starts the palpation assessment. So you're going to be checking for any tight muscles or anything that just feels off, especially when you're comparing from one side to the other side. Okay? So it's just a nice downward pressure into the muscle and then a slight squeeze. So now you can do these a number of ways. You can do them bilaterally at the same time. This way is really, really good if you're wanting to go ahead and compare from one side to the other. Or you can start with both hands and go in kind of a clockwise direction. Okay. So now what I'll do is I'm going to go ahead and undrape the back. Okay, so when I am undraping the back, what I'm looking for landmarks of where to undrape down to is in the very low back of your client. Some people have these visible, some don't. They're little dimples at the bottom. And what these are is they're right over the top of what we call the PSIS, the posterior sacroiliac. So basically you want to make sure you're below that, but above where the actual gluteal cleft would be. Okay, so we never want to expose the gluteal cleft. We make sure that we're just below those PSISs or those little dimples. We tuck the sheet into the underwear. We make sure that we pull and tuck tight into the sides, and then I usually go ahead and tuck the hands in as well, and then do the same to the other side. Okay, now if the client is not wearing underwear, you just make sure that you roll down, and the biggest change here is you just got to make sure you're really pulling tight and then tucking really, really well so the drape is secure and doesn't move. Okay? So the next technique I will show you is what we call effleurage. Okay? This is one of the most beginning techniques that we use. It's very, very good for introducing our touch to the client and also spreading the oil or lotion of what we're using. So I use a tiny amount of oil and put it on my hands. And then what we do is we start at the low back and you do a nice broad movement, the back and then down. Now your pressure is going to be as you're moving towards the head, but we still keep contact on the downward stroke. So it's pressure in the upward stroke, fan out over the shoulder blades, and then down this way. We're basically spreading that oil or lotion over the entire back surface area. So this is effleurage. It's a very broad stroke. It's not very much pressure. So it's going to slowly warm up their tissues. Like I said, get them used to our touch and spread out that oil or lotion. After we're finished with the effleurage strokes, I'm going to show you just stroking. So this is kind of like a modified effleurage. So it's not going to be as broad with both hands. It can be done with just one hand. It can be done with fingertips. It can be done with thumbs. It can be done with the ulnar border of our arm, and it can be done with our forearm. So we can do this lightly, or we can do it deeper. So a nice light stroke would just be one going up, just a straight stroke. Okay, that's light with the palm. We can do nice light strokes, what I like to do near the end of the treatment with the fingertips. Okay, generally when you move down with light stroking with your fingertips, if you go up towards the head, it's a little bit more stimulating. If you go down towards the feet, it's more relaxing. So at the very end, I like to just do a nice light stroke with my fingertips, almost like rain falling down. And it's very relaxing. You can do that with one hand, or you can do it with two. You just want to make sure you're not tickling the client, okay? Another stroke you can do is with your fingertips. So the pressure is going to be with your fingertips. Usually you go ahead and do this along with the direction, the fiber direction of the muscle tissue, okay? So you can do all the way up, say the erectors, which run along the spine all the way up the back. Or you can go ahead and use this around the scapulas. You can use your thumb, just a nice stroke around the scapulas, along the top of the scapula as well. It's just a nice smooth stroke. Now when you're using your thumbs, you can get a little bit deeper. If you want to get a lot deeper, I recommend using your forearm along the whole ulnar border, or you can use the tip of part of the ulna, which is going to be your elbow. So if you want to use a stroke with your forearm, you're using the border of your ulnar bone, and you're doing a nice solid deep stroke all the way up, focusing on these erectors, which are running all the way up the back. So I'm going with the actual fiber direction of those muscles. Now if you want to get even deeper, you can go and use the actual elbow itself. And then you can see the pressure is on the elbow, and I'm leaning my body in to get nice deep stroke going up that erector belly. Lots of people like to use the thumb as well, which we can go all the way up. And you can do one thumb, you can do a single thumb, or you can also do a reinforced thumb, where you'd have this thumb down and this thumb over top of this to go ahead and give you a little bit more control and pressure. Or like I said, you can use the fingertips. So you see my whole palm is in contact with the back, but the pressure is coming from my fingertips. And then we can also use knuckles for a knuckle stroke. So you would go ahead and do a closed fist. You can apply that pressure going up, trying to keep your wrist as straight as possible. Or even at the top of the table, you can use double knuckle here, and you can just do a nice knuckle stroke over the top of the shoulder blade. Okay, so that's our stroking. So remember, light, we can go ahead and do fingertips down. We can do a nice palmar stroke. As we get progressively deeper, we can go in with fingertips. We can do single fingertip. We can do reinforced fingertip. We can do thumb stroke, single or reinforced. We can do a knuckle stroke. we can use ulnar border, so our whole forearm. So the pressure is going all the way along this border of the ulnar bone. Or we can get even more precise and use the actual tip of our elbow. Okay, so that's stroking. I'm just doing a little bit more effleurage, some nice strokes in between all of these techniques. Now we can move into kneading. So this falls underneath the petrissage, just like the muscle compressions did. Okay, now kneading, basically it's a stroke done in a circular motion. We can do kneading with fingertip, thumb, palmar, knuckle, or open C. So I'll show you palmar first. So basically the whole palm is in contact with the client, and you're doing just little kneading circles. My pressure is going to be towards the heart, so it's going to be more in my upward stroke. Okay, so you can do by itself, or you can reinforce it with the other hand. I like to reinforce a lot just because it helps me get better control, and then if I do want to add a little bit more pressure, it's easier. I have both hands at my disposal. So that's palmar kneading, okay? And then we can move into fingertip kneading, okay? I'm still gonna have the whole surface of my palm in contact, but the pressure is gonna be coming from my fingertips. So it looks very similar to the palmar, except instead of all of the pressure coming through my whole palm, all the pressure is going to be focused into my fingertips. Again, you can do it on its own, or you can reinforce with the other hand. Always keeping those principles in mind. So direction of your pressure is going to be towards the heart, and in this case, the upward stroke. Okay, now we can move into thumb kneading. So we can go ahead and do this with one thumb. Or we can do alternating thumb kneading. So this is where we're going to use both hands. And I'm kneading by alternating my thumbs as I move up the back. Now normally when I'm doing this side of the body, I'm going to be on the other side of the table, so I'm not reaching. I'm just showing so it's a little bit easier for you to see on that side without my body blocking you. Okay, so that's thumb kneading. Then we can get into knuckle kneading, okay? So basically, again, you're using your knuckles, except now for it to be kneading, we're in a circular motion. And now moving into open C's. So to do an open C, what you want to do is literally make little C's with your hands. And then the pressure is going to be coming from the actual C that you're making. And so what you would do is I'm pressing with that C and then pressing with this other C of this hand. And I'm going back and forth as I move up the back. I'll show on that side of the back as well so it's easier for you to see. So you see the pressure is coming from the C that I'm making with my hands, and I'm going back and forth. Okay, so those are all of your kneading that fall underneath petrissage. Some other petrissage strokes is we have wringing. So wringing, I like to explain it as if you're wringing out a cloth. Works really, really good for your appendages, so your arms and legs, but you can definitely do it over the back as well. So what you're going to be going and doing is using your hand, and the pressure is going to be as the hands are coming together, as if you're wringing out a cloth. Just remember when you get up into the chest area to not go all the way over. We want to be cognizant that we're not going into the breast tissue. The pressure is when my hands are coming together. So that is wringing. Another petrissage technique is called picking up. Picking up works really well, especially for the arms and legs, but it can be done over certain areas of the back, namely over the low back. So what you're doing is exactly how the name suggests. You're picking up the muscle tissue. Now what I like to do is I start to press down first, and then I'm picking up the muscle tissue and pulling it towards me. So I'm pulling it in an upward direction, essentially picking it up. You can also do picking up at the very top of the body over the upper trap area. So what you can do for that is I usually slide my hand over, and then I'm picking up the muscle tissue. It's at the top of the shoulder. I'm using my fingers, I'm scooping underneath, and I'm picking it up. Okay, and the last petrissage technique that we'll go through is what we call skin rolling. Now when we do skin rolling without oil, it falls into more of a fascial technique. When we do it with oil, it's falling into a petrissage technique. So what you want to do with skin rolling is you're almost taking a piece of the tissue and making a roll between your fingers and your thumbs, and then you're slowly pushing your thumbs and pulling with your fingers to move that roll all the way up the back. So I'm picking up with my fingers and pushing with my thumbs at the same time to maintain that roll of tissue between my fingers and my thumbs. Now you can do this from the top of the table down as well. That is skin rolling. Okay, so moving on with some other Swedish techniques. Another one is vibrations. Now vibrations, they take a little bit of time to master. You'll want to use the entire palm to be in contact with the surface of your client. Now we can do fine vibes or coarse vibes. Fine vibes, if we maintain them for longer than 30 seconds, so say to a minute or longer, they're going to be very relaxing to the nervous system. If we do more coarser vibes for a short period of time, say less than 30 seconds, then they're going to be more stimulating to the nervous system, therefore stimulating to the muscle tissue, okay? So you can do this with one hand or reinforced hands, whichever you find easier for you. And what you're going to be doing is just contracting and releasing your muscle very, very quickly so that you're getting a vibration through your hand into the tissue. So it's hard to see it, but you can see my hand is slightly vibrating. So I'm doing fine vibes. Coarse vibes are going to look more like this. Fine vibes you can lightly see. They're really, really good to do the fine vibes over a longer period of time. If the muscle tissue itself is tender or very, very hypertonic, then this is a nice way to start the relaxation process so you can start to get into the muscle tissue more effectively. Most people have a dominant side. They're easier to do. I have a harder time doing the vibes with my left hand. So how I get around that is if, say, I'm on the other side of the body and I'm wanting to use the arm closer to the body, Just hold on here. Sorry about that, my screensaver came on. If I'm wanting to use the hand obviously closer to the body, so if I was on the other side and I wanted to use my left hand, I put my right hand over top, and then I'm doing the vibes with my right hand, and it's just moving through my left hand, since I'm a lot more stronger with my right dominant side. So those are vibrations. Now let's move into tapotement. Now we can get into categorizing tapotement as light or heavy. So the first two I will show you fall underneath light tapotement. The first one is called pansement, or if you're looking at it literally, it looks like pincement, but it's pansement. So all you're doing is almost like lightly pinching the client, okay? So you're not actually pinching, but you're doing these light little mini pinches. So I'm not using very much pressure. It's very light. And this can be quite stimulating. If you do it for a longer period of time and you slow your rate, it's more relaxing. The other light tapotement is what we call tapping. I don't usually use a lot of tapping over the back area. I reserve the light tapping over, say when we're doing facial massage for any sinus work. But to show that, we can go ahead and do, it's almost like playing the piano. It's light little taps with the fingers, or you can just do straight fingertip tapping. You do the alternating, or just every other finger. So this can be very stimulating. You'll see it was almost quite ticklish to my client. So that's why I generally don't ever do it on the back. So that's light tapotement. Now moving into heavy tapotement. The first one is called hacking. Well, Rattray calls it hacking. Looking into the muscle manual, we actually call it something different. It's either loose ulnar border percussion or hard ulnar border percussion. So the difference is, if it's loose ulnar border percussion, we're keeping our fingers loose. Okay, if it's hard, we're keeping our fingers stiff. And it's almost like the chop chop that you see in the movies, okay? So if I'm loose, I'm picking a grouping of muscles. My fingers are loose. And I'm doing a little chop chop. If I'm going to move into hard, I'm going to stiffen up my fingers, and it's going to penetrate the muscle a little bit deeper. So that is ulnar border percussion or hacking. Okay. Another heavier tapotement that we can do is clapping. Just what it sounds, except you're clapping against the client, okay? So you keep your hands, your fingers loose, and it's almost like you're slapping them. The next one is cupping. The difference here is we're actually making a slight cupping position with our hands, okay? And so you're going to hear the sound is quite different than the clapping. It's more of a suction-y sound. This one's really, really great to do on the posterior part of the back here over the lung area. If a client has just finished off a cold and they have a little bit of mucus congestion, this will help loosen that up for them. So that's clapping and cupping. Another one is called knuckle percussion. So what we're doing is we're making a fist, and we're going to use this part of our fist and hand. Okay, that's what's going to be in contact with your client. Making sure to be very careful you're not going over any bony prominences, and that you're staying on the actual muscle tissue. So that is knuckle percussion. And then the last tapotement is what we call pounding. So still we're going to be using a fist, except now we're going to use this part of the fist to be in contact with the client. So we're going to have our hands like this. And we're pounding over the muscle tissue. Again, being careful that you're not going over bony prominences, and be careful in this area here with your pressure. This is your kidney area. Okay, so those are our tapotement. The last few techniques we're going to go through is shaking, jostling, and rocking. These ones work really, really great actually for more of the appendages, but can be done over the back as well. Now, shaking and jostling, we generally group together. And what we're doing is basically, just like the name says, taking the muscle tissue and we're going to shake it or jostle it up. So we can do this over the back. We can do this with the arms and legs. And when we do it with the arms and legs, we can actually pick up the appendage and shake the muscle tissue out that way. So that's shaking and jostling. And the last one is rocking. Now generally what I do is I do rocking at the end of my treatment. So I like to end with Effleurage as well, just to really flush things out. I'm going to re-drape my client. Do a few more muscle compressions. And then we'll move into rocking. Now what's a nice sedating technique with rocking is I place one hand over their sacrum, right at their low back, and the other hand right at the top of the shoulder, and then I just slowly rock back and forth. It's very light. It's just getting their whole body to slightly rock. It mimics the feeling of a baby being rocked, especially the movement when they're still inside the womb, when the mother is just walking. This is very, very relaxing to the nervous system. Now you can also rock the entire body. A lot of therapists, they can start at the top and move their way down, and they'll just slightly rock the whole body all the way down. And that is rocking. All right, so those are all the main techniques for Swedish massage. Thanks.